Hi, everybody. Welcome to one of the biggest events that we are hosting. So today we will be joining forces with another organization. I'm not going to say too much about it at this moment because we've got our panelists and speakers here who will share exactly why we're here. So I will be your host for today, and I'll have Una Carney from, who will also be helping me with co-moderating. So today, essentially what we're doing is we're formalizing a partnership between these two organizations, the Peer Network and the International Initiative for Mental Health Leadership. And I think for us, it's a great milestone and vice versa. And I'm happy and excited about this as a big achievement for both organizations. And I am going to just quickly go through some of the house rules. So if we can all stay on mute, I'd love to have your faces on. So if you are comfortable with your cameras on, please keep it on. Just stay on mute until you have any questions. We'll be doing questions towards the end of the session, but if you want to comment, please feel free to do so in the chat box. We will be moderating that. And just I want to say a big warm welcome to our attendees on Facebook as well as Zoom. Really excited to have you guys here and hope you can engage with us. We've got a cute little exercise we'll do later. And for now, welcome and enjoy. And I will hand over to Una, who will start off the conversation.
Thanks, Claudia, and hello, everybody. Great to see so many people here and great to be here with you. I'm Una. I'm here supporting IIMHL and I'm very excited about this morning or this afternoon's or this evening's webinar, depending on where you are in the world. So we have got Charlene here from the Global Mental Health Peer Network, and we've got Steve Appleton from the president of WMHL, or the International Initiative of Mental Health Leadership, and this is the exciting partnership that Claudia has said that we are confirming and formalizing at today's event. So, and we also have Sandra here, who has lived experience of mental health and will also be joining in on the discussion, which is fantastic. Before I get involved and start the chat with the panel, I'd just like to ask all attendees to add to the chat or just write into the chat what 3 words come to mind when you hear the word leadership. What do you think of, and what do you think are the most important aspects of leadership? That'd be really good. We're really keen to hear from you all. So if I start, Charlene, with you, do you just want to just share and tell us a bit about the work of GMHPN and your purpose and why the work is so important to you?
Thank you so much, Una. Yeah, I think it's important to kind of step a bit back and see why and how the Peer Network was established. It basically emerged from my own lived experience at a certain moment that sparked my interest to create something that could positively impact on people's lives. And that moment was the day I was involuntarily admitted to a psychiatric hospital. And I was told that I had no rights, that my signature, hopefully today, will mean something. My signature means nothing because I couldn't enter into any agreement or legal contract. And I was also told that I was basically the property of the president. So that bothered me for several years. I couldn't understand why and how a diagnosis could all of a sudden deprive people of their rights and their dignity. And I became more and more aware of the flaws in the mental health system. And I think the most significant flaw was the absence of people with lived experience in service delivery and development of that, and their participation throughout decision-making processes. The end result of this, of course, is a system that doesn't speak to the actual needs of people with lived experience, but it rather enforces this empowerment of people with mental health conditions. So as experts by experience, our unique perspectives and insights can not only change lives of other people through co-creating policies and better and accessible, but more effective mental health care services. But in turn, it can also save governments a lot of money from a system that basically produces results and make a real impact. So how do we kind of ensure that people with lived experience are co-creators of policies and mental health services? So of course we know, and what I've seen throughout my journey and career in mental health, is that there are many barriers, from stigma and discrimination that we still struggle and battle against, disempowering practices like paternalism, decisions often being made on behalf of us, low mental health and human rights literacy, a predominant focus on the medical model instead of acknowledging that recovery is possible. And of course, probably the most important one is a lack of recognition that people with lived experience can add value to society, but also to the economy. So to encounter these challenges, leadership in mental health is absolutely critical. And that means across sectors, and that means including people with lived experience leadership. So how I see it is that leadership is not a one-person crusade. It's a collective leadership that is built on passion, respect, and appreciation for diversity that truly drives change. Sorry. So the peer network was established to kind of counter those challenges. So first of all, we serve two main purposes, and that is to develop global lived experience leadership. And secondly, to create a sophisticated communications platform for people with lived experience to be able to share their views and perspectives, but also to make recommendations to influence policy and practice. We are very proud to say that we are 100% lived experience across our structures, right from the top within our board of management, right to our country and regional representation. So we focus basically two aspects that's important. So first of all, we empower. We aim to improve human rights and mental health literacy. And we also provide mentorship. And to do that, that means we include people with lived experience into conversations and decision-making processes. And that gives a voice to people with lived experience. And with our communications platform, we provide that safe space where people can share their experiences without feeling insecure or not listened to. And that, of course, leads to creating leadership in mental health to drive change. Just to briefly look at where we stand in terms of statistics of the organization. When we started in 2018, we only had 14 lived experience leaders. Today we sit with, basically 4 years later, we sit with 112 from 39 countries. Our representation is quite diverse from low to high income countries. 51% of our representation are youth. So it's important to bring that youth element also in. And of course, what is quite interesting is the majority of our representation of female was 62%. For me, that was quite remarkable. I never thought that would happen, especially considering the biggest representation is from low and middle income countries. So just to end off, I just want to say that the peer network is really excited about this partnership. For us, it's about bringing our leadership, our lived experience leadership, together with professional leadership to achieve our common goals. Thank you so much.
Thanks so much, Charlene. Such a powerful start to the conversation in today's session. And Steve, can I come to you now and ask you just to briefly explain the work of IIMHL and the purpose and the importance of today and this partnership and collaboration?
Absolutely. Thank you, Una, and thank you, Charlene, as well for your introduction. So hello, everybody, wherever you are in the world. I see some familiar faces, so colleagues who are either up very early or it's getting towards the later part of the evening for them, and those that I can't see on Facebook, whatever time zone you're in, thank you for joining us. I'm Steve Appleton. I'm the President and Chief Executive of the International Initiative for Mental Health Leadership, or IIMHL for short, and also our associated organisation, the International Initiative for Disability Leadership. Our organisation has existed for almost 2 decades now, and we are a membership organisation comprised currently, certainly on the mental health side, of 10 member countries and regions. I'll just run through them and people pick me up if I forget any of them. But England, Scotland, Northern Ireland, the Republic of Ireland, Sweden, the Netherlands, New Zealand, Australia, Canada and the United States. So quite a diverse group of countries, but you'll have picked up that they are predominantly high income countries. And I'll say something about what we're trying to do in relation to that shortly. The organisation exists for a number of reasons, but principally it is to connect people working in the mental health space, leaders working in that space, to one another across countries and across continents, with the aim of enabling them to seek answers to difficult questions and challenges that they may be experiencing in attempting to improve the experience of people who receive mental health services in those countries and beyond. So our primary focus is around knowledge exchange, the rapid transfer of information around good practice, some transmission around policy development, but also thinking about how you really tackle some of those challenges in trying to improve services. So we operate a number of collaborative groups that are made up of leaders from our various countries. They're quite a diverse range of collaborative groups. They focus on issues ranging from children, young people and families to how you take forward ideas and initiatives in relation to population-based and preventative mental health programs in cities and urban regions, but also in rural areas. We also have a focus for clinical leaders, leaders working in public health environments. So as you can see, quite a wide range of different areas of work. We take part in webinars like this and indeed run our own. And just a couple of weeks ago, we ran an event with the NHS Confederation here in England, where I'm based, to launch a publication looking at innovation in mental health in response to COVID, with 13 different case studies from a whole range of different areas. We also run an international leadership exchange every 2 years, which is a week-long event. The first couple of days of that event focus on what we describe as matches, which are deep dives into specific topics, and those are co-designed between the hosts and the participants. And in the latter part of the week, we have a 2-day networking or traditional style conference event. This year, the event is taking place in Christchurch in New Zealand. It's going to be a hybrid event. Part of it will be virtual, but we'll also have regional hubs in North America and Europe so that people will be able to gather and meet in person. And those events have taken place around the world, as I say, pretty much every couple of years for the last 15 or 16 years or so. One of the other things that we're really focusing on now as well is the development of emerging leaders. People like me who've been around the mental health system for quite a long time, certainly over 30 years, are conscious that we need to ensure that there is a pipeline of succession for those of us who move on from working in this field, to bring forward leaders who can continue the work. And I'm pleased to see one of our emerging leader supporters, Aisling Blackmore from Western Australia, is with us today. Aisling's taking forward a programme of work both in disability and mental health to help to support emerging leaders to achieve their goals in moving into leadership positions. As an organisation, since I've taken over, and indeed prior to that, we've been looking at how we do our work and what our future strategy is. And through a series of consultation events and discussions, what became very clear to us was, although the representation of people with lived experience has been within our organisation pretty much since its inception, it's an area that we particularly want to focus on developing further over the next few years, and to really embed lived experience leadership within our organisation, both in our decision-making bodies, but in our collaboratives and in our events. I'll say a little bit more later on in the discussion about kind of what I think that means. But my own experience of working with people with lived experience is that it brings a richness to the dialogue. It brings direct experience from people who can tell you what works, what doesn't work, what goes well, and indeed, on some occasions, what is harmful. And those are the things that we need to avoid. And I suppose the other bit is about enabling people with lived experience to reach positions of leadership of influence. And our own definition of leadership is necessarily broad. It does not mean that you have to be a chief executive or a chief operating officer in a healthcare provider. Leadership can be seen at all levels in all kinds of organizations, but also in communities. And I think that that's really important for us to try to focus on and develop. So our own view of this is that lived experience should be central to all that we do and should be front and center in our thinking. And in a sense, that's why I'm so pleased that we're entering into this partnership with the Global Mental Health Peer Network. It was my great pleasure and also in a sense coincidence to meet Charlene. I think it was back in 2018 actually at a meeting, and of all places in a very wet and windy Geneva, and we started talking about our respective organizations. COVID kind of got in the way of us trying to move things forward as quickly as we would have liked, but I'm delighted that we're at this point where our two organizations are going to sign a memorandum of understanding to work together, to collaborate on various areas of work, but particularly we will benefit from the input of members of the Global Mental Health Peer Network in shaping our own work around lived experience engagement. And we hope that we will be able to reciprocate by enabling access to key leaders in different organizations and really beginning to tackle through open dialogue some of those key challenges and obstacles that we need to overcome to make the experience of people with mental health problems a much better one than it often is. So I'll stop at that point.
Thanks, Steve. That's great. I know before I bring Sandra into the conversation, WMHL has done some work recently, and indeed it's ongoing around developing what leadership means and a set of leadership principles. Do you just want to share, and I know we'll be hearing sort of virtually from one of the leads on that piece of work, but do you want to just share what some of the background to the importance of that work and how it's been developed?
Sure, happy to do that. I mean, I think as a leadership organisation, one that's focused on the development of effective and good leadership, it seemed to us that it was incumbent upon us as an organisation to really look at what are the principles of good leadership that we as an organisation should embody and demonstrate. What are the sorts of behaviours and activities that we should be demonstrating? But at the same time, those behaviours and ways of working that we should be actively promoting, both within our membership and more broadly. And we've done a whole range of work consulting our members and others to think about what those behaviours and values should be. And I think we've identified a number of key ones, and I'll share those with you now. The effective and good leadership should be inclusive. It should promote a sense of belonging. It should be a rights-based approach, and it should promote a culture that is just and is fair. By its very definition, if you're going to be a good leader, it's helpful if you're competent. Competence is sometimes a difficult thing to judge, but certainly you should model and promote self-care, well-being and resilience in terms of your competency. You should create flexible roles and working patterns. You should set clear goals and expectations. And you should invest in leadership capability in your own workforce, particularly with peers, with carers and in communities. Good leadership is authentic leadership. So that's about promoting an environment of psychological safety. It's about acting with integrity and honesty and humility. And it's about acknowledging and embracing complexity and unpredictability. Good leadership is also about collaboration, and that's what we're trying to demonstrate today. It's really important to engage communities in systemic change, to build trust in your relationships with a broad range of different stakeholders and partners, and to promote servant leadership and collective leadership models. If we're going to create change, we have to be innovative. The reason why sometimes things don't change or don't work in the way that we would like them to is that we're doing the same things that we've done before. And so we need to think a little bit more radically and kind of reinvent our approaches to service delivery and change. We have to ensure a culture of continuous learning and quality improvement. We need to test and evaluate new ideas, and we need to ensure equity of focus and investment in prevention and treatment. Those are just some examples. And finally, being visionary and strategic. It's quite hard in a sense to put a boundary around vision and strategy, but certainly to try to advance a vision for improved mental health, substance use and disability service development, to ensure the inclusion of different worldviews is really key. If you're a global organization, as we are, you need to do that. You need to be future focused and create an environment that empowers and enables everyone to contribute. So on that basis, I've done a lot of talking over the last 5 or 6 minutes. So now's the time for us to think about how we can have a discussion that everybody can contribute to. But I think we're going to hear from one of our colleagues, Peter Molyneux, who is our liaison in England. And Peter, along with our colleague Cathy Langlois, who's our North American regional lead, led this work around our values and leadership principles. And Peter's going to say a little bit more to expand on the themes of effective and good leadership.
Would you like Zach to share the
Yes,
video now?
please.
Yes, absolutely. That would be great.
Hello, I'm Peter Molyneux, and I'm the England liaison for IIMHL. IIMHL and IIDL seek to engage leaders to spread innovation, to share best practice, and to provide a supportive, creative and safe space for dialogue and conversation to take place. But what style of leadership is it that's required to make this reality across our networks, across our own organisations, and that we might want to promote to others? IIMHL and IIDL wanted to begin a dialogue about what the core elements of a leadership style might be that promotes their values and which is relevant to experts by experience, experts by occupation, regardless of the identities they may have. So the leadership framework that's been produced is the outcome of a number of conversations across both organisations to identify what leaders felt was important and to begin to pull this together into a framework. The purpose is to outline a number of leadership behaviours that we want to adopt within IIMHL and IIDL and to hold ourselves to account for their implementation. It also sets out a statement of what we believe our own networks, groups or organisations should be aspiring to. Leadership's a word that often gets qualified. We talk about compassionate leadership. We talk about facilitative leadership. Indeed, we might talk about toxic leadership. Through various conversations that were held in 2020 and 2021, a number of clear themes emerged. Our members talked about the need to be visionary, the need to be strategic, the need to be innovative. And to some extent, those are themes that you might expect any group of leaders to discuss. But they also talked about the need to be collaborative, the need to be authentic, and the need to be inclusive. Interestingly and importantly, it became clear that for our members, being inclusive is one of the most important leadership characteristics. To be an inclusive leader, you must be able to change what you're doing, to enable different perspectives to be heard, and to allow people to feel they can participate and contribute. Organisations all too often behave in ways that do not have a good impact on people. Inequality and discrimination society is imprinted by an organisation without realisation or recognition. So it's important not just to have diversity of expertise and experience, but also to rise to the challenge of how we hear and respect each other's opinions, that there's fair treatment across the organisation, and we recognise that we don't have all the answers and that we need to work collaboratively. Members felt that we need to have the curiosity not to settle for the obvious answers. So it's about listening with genuine interest and curiosity and responding with humility. It's about looking at the evidence and interrogating the data through an equity lens. It's all too easy to look at averages and not to notice that an intervention doesn't work well for everyone, or that certain groups are being excluded or not coming forward. At the end of the day, there was a recognition that we are all people organizations, that we need to remain caring and compassionate with a focus on equality and inclusion. But above all, that everyone must feel that the organization cares about them and that they have a sense of belonging. The framework is the beginning of a conversation about how we might develop the leadership behaviors that help us to achieve that. We really do hope that it will develop over time and that we can explore and learn together about what really works. Thank you.
Great. Lovely to hear from Peter, and he's very sorry he can't be here today. So I guess on that, and just thanks to everybody who's been contributing to the chat. There's lots of words coming out that we've heard there from Peter, but also from people who've joined us today. A lot of people talking about inclusion, collaboration, empowerment, and lovely as well to see words like kindness, and I saw torchbearer there, and it's really uplifting, and it's why it's so, as Steve said earlier, and the richness that comes from the conversation of actually when we hear the term leadership, what are we all talking about, and what do we think? Sandra, so I'm going to come to you next and ask you, as a person with lived experience, what does leadership mean to you?
Thanks, Una, and thanks for everybody today for joining. I'm very happy to be part of the conversation today. From my point of view, I'm looking at it obviously from a lived experience point of view, so I've simplified it as much as I possibly could. I think leadership for me personally, and first and foremost, primarily has been about acceptance. This has evolved over the years. So primarily it was accepting my condition and accepting what all of that entailed initially. And through that, I've also learned to accept that I actually am able to impart change on the movement of mental health. So it's accepting your power, it's accepting your inside ability or your intrinsic abilities to impart change and to better the voice for those with lived experience. Not only for those with lived experience, but for families and for friends, etc. So it's been quite beautiful for me on a personal level to actually see that all unfold. I think for me as well, education is massive. It's always been a fundamental of who I am as a human being and as a professional. Through education, I believe that we can never learn enough, and by learning, I think that's the greatest, one of the greatest forms of leadership. There's that famous saying of every morning I wake up and I still know nothing. I like to change it a bit and say I might not know anything, but I can feel different. So that for me, like I say, education is fundamental. More than anything, I think empathy is something that the world in general lacks. To actually be able to put yourself into somebody else's shoes as a leader or in any kind of situation, I think is a level of intelligence that is much needed, and that is key to being a great leader as well. It's fundamental in personal growth and in growth of those around you, and also in strength. So yeah, that for me is very simplistic, but sometimes simple is better and beautiful for my journey with my lived experience.
That's wonderful. Thank you, Sandra. And I guess just to ask you about your involvement with the Global Mental Health Peer Network, and what kind of, what have you experienced in the sense of from your own personal development or professional development, or just tell us a bit about that.
Sure, with pleasure. I've said it on many platforms, but the peer network has very much been therapeutic for me. I think fundamental to healing as well is being able to talk about your experiences. And for many years, I'd never felt like I had the platform where I was not going to be judged. And I feel free to share my struggles, my joys, everything basically within a space which holds me. And through that, it's shown me growth, and it's had a collateral impact in my life where I speak openly about my experiences with colleagues, with families, with friends. And, you know, sometimes we don't know the full impact that we're having, but I do believe that it sifts through. And that for me is incredible. So that's why I say it's my therapy in so many ways. And I have also said this many times, but it's much cheaper than actual therapy.
Absolutely. Charlene, can I just ask you, in the sense of, not to put you too much on the spot, but if you were giving advice to people and leaders that work within, the professionals, if you like, but work within mental health, what advice would you like to give them in terms of how to drive change and how to, I guess, pivot the conversation to include people with lived experience and to acknowledge their own experience and I guess what they can offer in terms of influencing the change?
Thanks, Una. I always think the most valuable skill someone can have is to listen and appreciate diversity. I think for me, just looking at within the Global Mental Health Peer Network, we're such a diverse group across the world, and I learn every day or every moment something from everybody. And I think I've gotten more knowledge from being included into that diversity. And I think we need to understand that diversity should be celebrated, and we shouldn't like oppose. We should have open minds, and not everybody is the same. Not everybody has the same experience, so we need to respect different experiences. That for me is very important.
Thank you, and thanks, Charlene. And Steve, given that we've heard from Peter, and you've also set out the I guess the background and importance of developing the leadership principles for IIMHL, but what, in your view, would you say is key in terms of for professionals interested in working in mental health, and how they can best make an impact, you know, whether they're new to it or people are thinking about a change in role? What would your advice or I guess thinking be on that?
I'll offer some thoughts rather than advice, I think, unless you take the view that if you offer advice, you should be prepared for it to be ignored. So I think in terms of offering some thoughts, it's important to say that in my view, the issue of leadership goes beyond professionals working in the mental health field. The issue of leadership is also about people with lived experience who may not be in professional roles, but how they are engaged to find a way to engage in a leadership role that's about action and about change. But it's also about leadership in other organizations beyond traditional mental health providers. It's about leadership in organizations that deal with issues to do with housing or leisure or environment, indeed within employers and businesses. So the issue of leadership is not confined simply to healthcare or social care. I think my own experience is that it's really important to try and understand and identify the critical challenges and issues that you face within your system, whether that be at a country level, at a regional level, or at a community level. It's really, really key to identify what are the things that exist that you need to change, what's working, what isn't working, and how are you going to do that. I think building on what Charlene was saying, it's also about how you actively listen to people and take on board a diversity of views. It's trying to understand what people's experience is and let them speak freely, openly, and honestly about their experience, and to not judge whether that's right or wrong. It's just somebody's experience. But actually, the more that you hear that, the broader your view can be in terms of what you might do. I think there's something within leadership that's about how you take decisions. And there is a need, I think, for a co-productive approach, particularly with people with lived experience, who I think very often their experience of being involved in decision-making processes, particularly through things like public consultation, is a sense that decisions have already been made before they're spoken to, so that no matter what they say won't make any difference. So you really need to start right at the beginning and see it as an area of engagement that spans all that you do. It isn't an add-on, it's not a luxury, it's something that should be fundamental to your leadership approach. Being determined, because actually doing some of this stuff is hard work, it's tough. And sometimes not everybody will agree with you. Sometimes you'll need to take difficult decisions, so you have to be determined. I think the other issue around making an impact is it's really difficult to do these things on your own. And actually leadership can be a lonely place. And whether you're a very senior leader or whether you're somebody who's not in a CEO type role, it's really important to create networks of support and to also understand that you're not always the expert. You know, draw in the views and experiences of other people. And in a sense, that's kind of what IIMHL is about. It's about drawing upon the experiences and knowledge of a range of people in different roles, in different organizations, in different countries. There are some commonalities to the sorts of challenges that they face. And sometimes there are some commonalities at the way they've approached the means to overcome those challenges. But by understanding that other people are facing similar challenges, you can get a sense that you're not the only one, and you can also get some strength and support in that. So I think it's really important to build those sorts of networks, both in communities, organizations, and broadly. And I think that the other key element of this is that my experience over certainly the last 10 years or so is that those traditional models of a sort of hierarchy of leadership have largely begun to disappear. If not completely eradicated, they have begun to disappear. And so that sense of there's somebody at the top and everybody else lower down doesn't really work anymore. We have to have a much flatter approach to how we engage and how we make decisions. So getting into discussions with a range of different people, taking on board a range of different views, and then ultimately being able to make a decision is really important. And the principles that Peter talked about and that I outlined earlier on, I mean, my sense of that is that those are sensible ways of working that are really quite hard to argue with. It's not quite motherhood and apple pie, but it is really sensible stuff. And if we can encourage people to work in that way, we will create the conditions for much more effective change. And we'll also create the conditions where people with lived experience feel much more included, much more involved, and actually get to a point where they're the people that are taking decisions. Because as I said earlier on, people with mental health problems are the best qualified people to advise us and tell us what works and what doesn't work.
Thanks, Steve. I totally agree, but lots of people agreeing in the chat and also from the people I can see nodding along. But Claudia, I just wondered if you wanted to come in there and if there was anything from your perspective you wanted to add or challenge indeed.
Yeah, thank you. I think I'm just going to add on to what Steve literally just ended with, the fact that people with lived experience have that unique perspective, right? And the way in which we like to sort of explore it, or when we do have platforms like this available and we get to talk about it, is people that have lived with or continue to live with lived experience with mental health conditions, they learned how to navigate the systems on their own. They didn't have somebody most of the time, or 90% of the people wouldn't have had extra support, knowledge to help them go through the systems and navigate what's right and what's wrong, and what were the barriers, what helped, what didn't. And for me personally, I was hospitalized on 2 occasions, and after the second time, I still thought to myself, I've got all the tools from being in hospital, I've been given medication, I've got all the tools, but now I need to go back to the workplace. And at that time, I worked at quite a large corporate. And it was actually very difficult for me to reintegrate back into the corporate space, to reintegrate just into the society. And what I found worked was the leadership that I got from Charlene. And through that is, and then she then eventually brought me on into the peer network. And I think it was that moment where I realized, hold on, somebody that understands me from because of what I went through, that we may not have gone through the same thing, we may not have had the same challenges, but we have the same sort of forward-thinking approach. We need to help others be in a better place. I wish I could have gone back 10 years ago and had the same, that we're offering now, and together with your partnership even more so. So I kind of just wanted to add that I think that's the value of lived experience. And we also really challenge stakeholders to not just take what we say as a tick box exercise and not actually then include it into the policy that you asked us to give recommendations on, to actually use them. So that's, as we as an organization are growing, we're getting more comfortable with that, and we're getting stronger voices, and that's eventually going to come out, I think, a lot stronger. So I sort of wanted to add that.
Thank you. Thanks so much, Claudia, and thanks for sharing your own personal story too. Charlene, it kind of builds on, I noticed in the chat, you put it in there, just that point Claudia made about it not being a sort of tick box, but actually to get the engagement right from the beginning. Do you want to just expand and talk a little bit about that?
Absolutely. Yeah, I think that's why I said in the chat box too, when you engage with people with lived experience, to do it from the outset, right from the planning or even the idea phase, right towards the end and afterwards. Not just as an afterthought to say, yes, we need to, because now it's globally, emphasized, you need to include people with lived experience. And now you just, yes, we did, but you did it, kind of towards the end or in the middle. What you actually create by doing that is disempowering people, because you dump them in the middle. You feel that they're not important enough to add them right from the beginning in this process, throughout the process. Because if you add them or include them right from the beginning, you're empowering people. And that is also when you create leadership, is when you include them right from the beginning. So I just feel we always speak about meaningful and authentic engagement or inclusion, because that means what we say needs to reflect in whatever we give input into or advise. And meaningful also means empowering people to participate effectively, because I've seen a lot in earlier years in my career. For example, let's say government would say, okay, here's a law that's up for review, and just randomly select people with lived experience to input. Not everybody's got legal backgrounds or understand legal terms. So how is that fair to expect that person to meaningfully participate or be included in that process if you haven't given them the tools to do so? So that is why we focus also a lot on the empowerment. You need to empower people to meaningfully participate.
Thank you. Thanks, Charlene. And Sandra, and I'm mindful that the chat is filling up. And so, I think Charlene and Steve and Claudia, we've talked about in the preparation for this session that actually this will probably and hopefully be part of the relationship, that we have more of these open conversations and invite insights and views from others. And we'll be taking stock of all the comments and questions that are coming in and packaging up maybe how we respond to that and how we move the conversation forward. But Sandra, could I just ask you, just I guess feeding on from what Charlene has just shared, what kind of any sort of advice or I guess encouragement you might give to people who are living with mental health problems, and what your kind of your word of encouragement or advice would be?
Sure. It's actually quite interesting for me when I was posed with this question, and I actually thought about it quite in-depthly. And in times when I've been at very low lows in my life, often what I've done is I've gone online and I've looked for stories of success in many ways. And I clearly remember a few years ago, I read a story, and the one word that stuck out to me was survive. And that's all I needed to see that day. I just needed to get that encouragement that I needed to survive that day. I'm also very aware that ironically and very symbolically for me, I have in many ways become what I have been searching for many years. I am that story that I hope that someone can find online one day and go, look, she survived. Not only that, I'm actually doing very, relatively well. I don't want to say very well, because as I say, you can always be better in many ways. But I think that's my story to share, and to say to anyone who's struggling that sometimes it's really just okay to survive, but potentially you can thrive at some point, and your life does have meaning, and you do matter. And it's very cliche, but it really, that's what I would like to share to anyone who's struggling with mental health conditions at the moment.
Thank you. Thanks, Sandra. And what an uplifting way to bring the session to a near close. Claudia, can I hand back to you now to take us through the final stages and indeed the big moment?
Absolutely. Okay, so now we, I think, just going back quickly with what Una had said earlier, the comments or the 3 words that you guys put in the chat box, I can just show you. I mean, you probably won't see it, but I put ticks. I wrote everything down, and as the panelists, as speakers were speaking, I'm like, okay, there it is, tick. So I'm a bit of a nerd in that regard, so I ticked everything. And we're very much on the same page, which is really great. So that means that, we can really take this forward. And after we do the actual signing of the MOU, there were a few questions, and I think maybe we can go back if we've got some time to just get those answered. So yeah, to formalize this wonderful collaboration and sort of partnership, even though it's not a full-on partnership, but I think our values are aligned. You guys heard it yourselves. Both organizations have similar values, just done differently. We just have different ways of doing it. And I think together we really are going to make a great team. Your networks, it's IIMHL. I always get that confused. I eventually got peer network right, but now I've got to start learning this name. But I think we're going to have a great relationship. We're going to really benefit from each other's knowledge sharing, what we do as organizations, and the structures within which we work. So I think this is the moment. So I think Zach, who's our IT guy, if you can do a wonderful spotlight on Charlene. We'll start with Charlene and get the first signature going. And there we go. Okay, Charlene, so when you're ready.
Okay, here we go.
Put your paper little down. There we go. That's a wonderful signature.
I know someone's gonna complain about my signature. At least it means something.
It definitely means something. This is really awesome. Thank you so much.
Thank you.
Shall we move, Steve? You're going to try? I know you might not be able to completely turn your camera, but that's okay.
Yeah, unfortunately, I can't duck my camera down low enough to my desk, but I'm going to demonstrate. I have the ceremonial pen in my hand. So I'm going to sign now, and then I'll hold it up and see if you can see it. I'm not sure if you'll be able to, but you can just about make it out.
Yes, we can.
So there we are. We're formally in a collaboration, and I couldn't be more delighted. And can I thank you, Charlene and Claudia in particular, for helping us to get to this point. And I know we're going to have a bit more discussion, but I also want to thank Sandra for her input today. It's been incredibly important and insightful. And I think you are doing very well, if that's not too grand a thing to say, and delighted to have met you today and for you to be here. I think we've all learned a lot and gained a lot from what you've had to say.
Fantastic. Thank you. That's amazing. So now that we've got the signatures done, it's official. Zach, you can remove the spotlight, or Steve, otherwise. And just let us get back to the normal screen. And then Una, I'll hand it over to you to just have a look at the questions maybe in the chat that we can.
Yes. So Vivian has put a question in to say, is it easier to take on a leadership role when you are further into your own process of recovery, as in you have the energy and stability to do so? And she has shared in her own experience some subjects change during recovery. And what's the opinion on this? How do you include and empower all views in all stages of the process? So thoughts on that. Shall I go to you first, Charlene, and then maybe Sandra, you might have your own experience and insight to share.
Yeah, I always say it's up to the person to really say. You know, that person knows themselves, so they must know if they're up to taking on a leadership position, no matter where they are in their recovery journey. For some, like Sandra actually mentioned, it was almost like, it's like therapeutic. So maybe it's not necessarily that you need to have gone much further into your recovery to benefit from being in that role. So for me, it depends really on that. The other question was, the second part of that question was, how do you, sorry, my concentration is short.
That's okay. It was, so how do you kind of keep that, I guess, to summarize, the dialogue going as the situation changes?
Oh, okay. Yeah, I think, again, it's informed by that person. I think we always need to allow people to kind of express what, you know, what their needs are and what they want. That's always so important.
Thank you. And Sandra, do you have anything to add in there?
Much to echo what Charlene has said, I think it's very person dependent. Obviously, as I mentioned, the peer network has helped me in many ways, but I'm also very cognizant of the fact that I was at a point where I was ready to speak about my story and speak about my experiences rather. So I think it's very important as to where you are as a person through your journey. I know for me, coming straight out of hospitals on a number of occasions was perhaps not the best time. So yeah, I completely echo exactly what Charlene said. It's very person dependent at the end of the day.
Thank you. Thanks, Sandra. And we have another question, Steve, in from Sean McNeil. I know Kathy's here too, and I've seen Sean, so this by all means jump in, but just a question on, I know there's a lot of work underway in terms of strategic priorities for IIMHL, but just a question around the progression of a counsellor advisory group of people with lived experience. So I'll go to you first, Steve.
Yeah, sure. Thank you, Una, and thanks for the question, Sean. I mean, we are been in the midst of a range of bits of work to look at how we address issues of inclusion and diversity within WMHL and IIDL, both now and in the future. And we've engaged in what we describe as a pre-consultative process, talking with a number of our members and gathering their views about the sorts of approaches that we might take and the kind of work that we might need to do, with a view to thinking about the development of what we describe as an inclusion advisory group and a lived experience council. I'm very hopeful that both those things are going to move forward in the coming weeks. The outputs from that pre-consultation period are being collated at the moment, and some recommendations will be made to me by Kathy and other members of the team about how we should proceed with that. And we'll be encouraging people to get involved and give their views as we develop those. I think it's an interesting and sometimes difficult debate about whether you have specific groups for these kinds of areas of work. But I think our general view is that if not that, then what? We need to create the space for the discussion to take place, with a view that at some stage through our work, it becomes so deeply embedded as a kind of golden thread through everything we do that the need for such a sort of specialist standalone group is negated in the longer run. But I think at the moment that probably isn't the case. And I guess that's just a broader issue of inclusion. I mean, one of the good things about IIMHL, and this is probably an opportunity to say it, is that people can join the organisation as an individual member at no charge. And we have just under 5,000 members, not just within our 10 existing member countries, but there are members from other countries too. So if people are listening and watching and want to get involved and take part in our work and benefit from what we do, please go to our website, WMHL.com, where you can join up as an individual member. As I say, there's absolutely no charge for that, and you'll get a range of benefits which you can see detailed on the website. So I think, you know, this work is moving forward. It's early stages. What I'm learning in my leadership journey is, or what I'm trying to learn, shall I put it that way, in this role, is balancing pace with rigor. I'm an impatient person by nature. I want things to change and I want things to move on, but I also want to make sure that we do it properly and we do it right first time. So, you know, if people feel it's taking a little bit of time, well, we're only kind of 8 or 9 weeks into this process. And I see it as a process that will be dynamic and iterative and go on. It won't have a fixed point in time that we stop thinking about these issues. So we're moving forward and we'll move as quickly as we possibly can, but we want to get it right the first time.
Great, thank you, Steve. And Sandra, could I just give you the final word, if I may? And given that we've seen, sorry to put you on the spot, but we've seen that the agreement is signed, and this webinar today has been a sort of a starter in the conversation and the collaboration. What would you hope to see come out of it, or what would you like to see as the next steps in this partnership?
That is putting me on the spot. But I think, you know, I think a common thread through today is a sense of belonging and collaboration. And I think the more we can do that as organizations, as individuals, it is key at the end of the day. You know, it's one of the primary physiological, psychological needs as human beings. So the more we can collaborate and listen and empathize with each other, the better it's going to be at the end of the day for people with lived experience, or just for humanity in a sense. So yeah, that's my final word there.
Thank you, and sorry to put you on the spot.
No problem.
From my point of view, just to say thanks to everyone and the panelists for putting up with my questions and trying to manage the meeting and chat, and your patience around that, and massively the support from Zach on the tech side of things. So thanks to everyone. Claudia, can I just hand back to you again?
Absolutely. Yeah, so I think I also just want to say thank you to Sandra, and please send our thank you to Peter as well, for sharing a really nice video, and to Steve and Charlene for sharing why the organizations exist, what they do. It's very important to know why we're collaborating, why we're becoming a partnership or developing a partnership. And for me, it's really exciting because, you know, I think for us, we're a smaller, or we're a younger organization, but to be doing things like this is really amazing. And it just shows, you know, like I had mentioned earlier in the chat, collaboration over competition. We shouldn't be fragmenting all our efforts. It should all come together. So this is a perfect example of that. So I just want to thank you all for joining, participants, attendees. This is really amazing, and you will hear from us again. I'll make sure that we do another webinar. I love talking, so I will make sure there's another webinar. And we'd love to have all you guys back again for more conversation. Right? Yeah, so I think we're done from our side. If anyone else has any last comments.
And just to thank you, Claudia, and also Una for facilitating the discussion today, and to Charlene and colleagues for getting us to this point. It's been a great pleasure to talk with you all today. Thanks for joining.
Absolutely. Take care, everybody.
I just like to say thank you.
Sorry.
Thank you for our fanatic webinar person, Claudia. Always doing a great job moderating. And Una, thank you very much. Zach, handling the tech side of things. And Steve for joining, and IIMHL for the collaboration, and everybody who joined. We're really looking forward to this. Thank you. Now you can go.
Everybody,
Bye.
take care now. Bye-bye. Bye-bye.